Hi, I'm Dr. Kim with ProacuHealth, integrative medicine and acupuncture for pain management and your well-being. This video is about do-it-yourself cupping for pain relief. Real quick, what is cupping? Cupping is the use of cups to increase circulation, relax tight muscles, and decrease pain. Cups used for modern cupping techniques include plastic, glass, and ceramic, but you can also find plenty of other kinds, such as wooden cups or even silicone cups. In the clinical setting, I like to use glass or plastic cups. For self-cupping, I recommend and use plastic cups. The reason for this is it's a lot easier to cup yourself with the plastic cups, and then also if they fall, which they tend to fall, then you won't have to worry about cleaning up any broken bits of glass. So how do the cups stay on? The basis of cupping is that we create a vacuum effect, which then causes the cups to gently suction onto the skin and tissue. We create this suction by manually pumping out the air in the plastic cups and by using a flaming cotton ball for the glass and ceramic type cups. Sounds scary? It's actually not if you're being worked on by a trained professional. And don't worry, everything that we go over today is simple and safe self-cupping with plastic cups. There are so many cupping techniques out there, so I'm sure that once you learn the basics, you'll be eager to find a practitioner or a technique that works best for you. For now, just know that cupping can be wet or dry and stationary or moving. Wet cupping is the combination of cupping and small cuts or needle pricks in order to draw out a small amount of blood. This is believed to help remove toxins as well as to promote healing. For this video, we'll only be doing dry cupping, regular or stationary cups versus moving or sliding cups. Cups can be left in one spot or moved around for a massage-like effect. For self-cupping, I leave the cup or cups on for 2 to 5 minutes. If I want or need a little more, I'll just go ahead and reapply in the same spot at a later time in the session. The reason for this is I don't want to leave it on for too long to damage the skin. Cupping tends to leave marks or bruises where they're applied. In Eastern medicine, the colors produced by the cups have different meanings, but in general, we'll see light pink, reddish, purplish, and it's important to note that these bruises or colorations could last anywhere from a few minutes to a couple days. All of this is normal. Cupping is relatively safe if you're seeing a trained professional or if you're taking the utmost care when doing self-cupping. However, with all things health related, it's recommended that you see your primary healthcare provider before starting any new therapies, such as cupping. Cupping side effects include mild discomfort, burns if you're using the flaming cotton ball, bruising, which we've already discussed, and skin infections. So you want to be very careful not to cup over open wounds, and also don't share your cupping tools. And if you do, make sure you thoroughly disinfect them between each use. Cupping should be used with extreme caution if you're pregnant or if you have severe skin conditions. Some things to keep in mind for cupping safety. We want the light pinkish, reddish, purplish color, but really you want to be careful because you don't want to leave the cups on too long as they will damage your skin. Avoid cuts or open wounds while cupping to prevent infections. Avoid cupping over bone and areas with thin skin. The cups won't stay on too well, and the thinner the skin, the easier it is to damage the tissue. You really don't need that much suction, so really start mild and then work your way up. 2 to 4 pumps should be enough, but keep in mind, the smaller the cup, the greater the suction. So maybe use less pumps for a smaller cup in order to avoid skin damage. There are many conditions that benefit from cupping, so I'll only name a few. Pain, poor circulation, blood disorders, high blood pressure, asthma, fibromyalgia, arthritis, eczema, acne, migraines, anxiety, and depression. Cupping sets. You can get your own cupping set from Amazon. Just make sure that you get the one with the extension tube. When I get an Amazon affiliate link, I will include it in my descriptions. It wouldn't cost you anything extra, but it will definitely help me out. so thank you. Or if you want to shop local, my friend and colleague owns and operates Acu Depot in Southern California. They sell all things Eastern and alternative medicine, so it's really fun to explore their store. The area you choose to self-cup will determine the position that you should be in. So for example, if I'm cupping my neck or my shoulders or my upper back, I'll most likely be in a sitting or standing position. But if I'm cupping my lower back or my hip area, most likely I'll be in the laying down position. You just have to figure out what works for you. When deciding where to cup, you can choose traditional acupuncture meridian points, or you can choose ashi points, which are points of sensitivity and pain. So let's start cupping in 6 easy steps. Step 1, get your cupping supplies ready and prepare the skin for cupping. The skin should be clean, or you can wipe it with an alcohol wipe. Step 2, move over the area slowly with your fingers, palpating gently to find areas of pain and sensitivity. Step 3, once you've chosen a spot to cup, make sure everything's attached. Suction device, tube, cup. I'll then take it and put it over where I palpated. Step 4, squeeze the trigger 2 to 4 times to create suction. Then to take off the extension cord, simply twist and remove. Look at that suction. Let's see that again in a different spot. Shoulder. 4 pumps to remove. Twist the extension cord, and there you go. Step 5, leave the cups on for 2 to 5 minutes. And as mentioned before, do not leave them on for too long. During this time, you can gently stretch the isolated muscle, or you can simply sit and breathe. Step 6, remove the cup by gently pulling on the pin. This will release the suction and the cups will come right off. Now, repeat steps 1 through 6 until you finish your cupping session. Just as a side note, some people like to cup only one spot at a time, while others like to use multiple cups at a time. It's really up to you. Maybe start with 1 cup in the beginning and then add cups as you become a self-cupping expert. Okay guys, thank you so much for watching this video. If you enjoyed it and want others to feel pain relief, please like, share, and subscribe. Thank you so much. Lots of love. See you next time.